Hello, everyone, and welcome to Functional Fertility, the podcast designed to demystify your hormones, up-level your lifestyle, and supercharge your fertility potential. I'm your host, Dr. Kalea Wattles, and today I'm excited to add a layer of detail to all the conversations we've been having about gut health by talking specifically about the impact of both the gut and the vaginal microbiome on embryo implantation and IVF success. I'm so fortunate to have a guest with me today who happens to have a lot of insight about this topic. I'm joined by Cheryl Sew Hoy, founder and CEO of Tiny Health. Cheryl founded Tiny Health in 2020 with a goal to take charge of her family's microbiome health after giving birth to her 2 children when she realized that early life microbiome imbalances are actually linked to many chronic conditions later in life. Now, Tiny Health is involved in some really important research looking at the connection between the microbiome and fertility. I'm super excited for this episode. I always learn something new. Welcome to the show, Cheryl.
Hi, Dr. Kalea. I'm so happy to be back on your show. We did an IG Live a few months ago, and really honored to be back on your podcast.
I've been learning so much about Tiny Health and the work that you're doing. And after we did our IG Live together, so many listeners wrote into me and they said, okay, I'm really excited that I can test the microbiome in the gut and in the vagina, but how do I actually collect the sample? What does that look like? So I thought we would start today's episode if you'll just give us an overview of the testing options that Tiny Health offers and how the sample is actually collected.
Oh, great. Yeah, that's easy. So I started Tiny Health in 2020, and we did about 2 years of R&D before we launched in April 2022. And we are basically the first at-home microbiome test for the gut and vaginal microbiome of someone trying to conceive and who then gets pregnant, ideally. And then also we have the first baby gut health test for 3 years and under. So really a pioneer in the space. And basically the gut microbiome, the way you can test that is through the stool. So, actually circling back to what even the microbiome is, in case listeners don't know, it is there. We do have 38 trillion microbes living in and on us, and there are many microbiome sites on our body or in our bodies, right? There's the oral microbiome, skin microbiome, there's the gut microbiome, the vaginal microbiome. So different kind of colonies that different colonies that basically live in and on our bodies that are, can be correlated with health and disease. So the gut microbiome is the most studied as it relates to health or disease states because it's the most accessible through the stool. And it's a really easy sample. At Tiny Health, it's an at-home test. We mail you a swab, and it's kind of like a Q-tip, and you can sample directly from soiled toilet paper, or if you're sampling a child, you can take it directly from a dirty diaper, basically. And the stool, as it relates to the gut, is the most well-studied because there's a lot of microbes or bacteria that lives in a non-oxygen tolerant environment. So in the gut, there's no oxygen. So different bacteria live in the gut from the oral microbiome or the skin microbiome. So it's really interesting, and there's a lot of science around that. And then the other site that we mentioned is the vaginal microbiome. So you'll get a swab that's very similar to what you do at the OBGYN sort of doctor's visit for your annual pap smear exam. It's very similar to that. So you can actually do it at home now. You get a longer swab than the stool swab, and you're just kind of like swabbing your vaginal canal. And then once you swab either the stool or vaginal microbiome, you just put the cap back on and you throw it in a prepaid envelope, drop it in any USPS mailbox, and then our lab gets it, sequences it, uncovers all the microbiome, the microbes in your gut or vaginal. So all the bacteria, fungi, if there's any, parasites, viruses, archaea, anything. And we give you a report in a couple of weeks about what that means for your gut and vaginal health.
It is amazing to me that this is available to us at home, that there is all of this insight to be taken from our microbiome, and we can understand what's happening in our body. So we're going to collect our sample, we'll send it in, then a report is generated. Will you just kind of high level overview, is it a combination of, is it nutrition and lifestyle and supplements? What type of actionable recommendations can people expect once they get that report back?
Yes, I started this company because my daughter was born by a C-section, and then she had eczema, very colicky. She cried a lot, didn't sleep very well, and then she had some food sensitivities as well. And when I was doing my research, I uncovered that it was linked back to sort of early life microbiome dysbiosis, so an imbalance in a baby's gut in early life in the first 1,000 days. And so I created this company for parents as a parent to really figure out, well, if there are any imbalances, how can I course correct, right? So our test results are our reports are very empowering in the sense that we give you tools that you can do to correct the imbalances via diet or nutrition. So that's the first category. And then via supplements, if you prefer supplements. And then the third category is lifestyle changes. So everything that we recommend is evidence-backed. We have citations proving that a certain foods or supplement or ingredient in a supplement or pre-probiotic can influence the microbiome, whether gut or vaginal microbiome. So it's very actionable, and that's what our users, our customers really love, is that you can actually do something about your microbiome. If you think about, genetic testing, it's informative and educational to know about your genetics, but you are given that and you can't really change it. But with your microbiome, it's, especially in the early days, it's very malleable. And if you're trying to conceive, it's even more important because there's not just a lot of correlation with certain conditions during the conception period and pregnancy. It's also something you're actually passing on to your child at birth, right? If you do have a successful pregnancy and give birth, you are passing on those vaginal and gut microbes to your child. And that relationship actually has lifelong immune impact to your child, your future child.
It's so important. And so you mentioned before that you can do the testing along the whole spectrum of your fertility journey, pre-conception and then during pregnancy, and then we can test baby's microbiome too. So I guess if anybody is listening and they're like, if I'm already pregnant, is it too late to do something? I wanted to get your insight.
No, never too late, right? So, it depends which trimester. I think in the first trimester, ideally, you take a sample then. I mean, ideally, you take a sample even during conception.
Yeah.
And the only reason for that is because it takes an adult a longer time to change their microbiome. If there are certain imbalances or deficiencies, or maybe overabundant of certain pathogenic bacteria, it may take about 2 to 3 months to course correct through, again, dietary or supplement or lifestyle changes, right? So it really depends. I think a lot of people who do get pregnant test in the first or early second trimester. That's ideally when you would test. And then they do some course correction if needed. And then they test again in the third trimester to see if those imbalances have changed. Because you'd want it to be, again, like course corrected. If you are planning to breastfeed your infant, you are actually continuing to pass on your gut microbes to your child through your breast milk, which is a really fascinating area of science as well.
Yes, it's all so fascinating. It makes me want to just look up research articles and read about it all day. So a lot of my patients are they're preparing for pregnancy, whether they're trying on their own or they're getting ready for IUI or IVF. Do we have a sense of what testing should be prioritized? If we had to choose one, which one would you choose as we prepare for pregnancy?
That's a great question. So I would actually look at the vaginal microbiome test first in the conception TTC period, because there is more science between the vaginal microbiome and its community state types, the different kind of categorization or phenotypes of the vaginal microbiome as it relates to IVF success or failure, which is in a sense a proxy to fertility as well. There's no really good studies relating the vaginal microbiome with pregnancy outcome or pregnancy rates specifically, but there are some with IVF success. So I would start there because there and I can maybe dive into what state types are there in the vaginal microbiome.
That would be really helpful.
Okay, yeah. So basically, maybe going back a step, what is the vaginal microbiome, and what should the vaginal microbiome have to, is there a healthy vaginal microbiome versus unhealthy vaginal microbiome, and what does that mean, right? So, before that, even women were not included in any clinical research before 1993. So we have a lot to catch up on. And since then, there has been a lot of research and science around, what really is in the vaginal microbiome, right? So it's emerging science, but very interesting. And basically, we now know that the vaginal microbiome should be in an acidic environment. So sometimes when you do go to the OBGYN's office and you get a swab, they do measure if it's in an acidic environment. If it's in an alkaline environment, then it's not in a healthy state. So, but since that, sort of pH level technology, we now have the technology like using shotgun sequencing, which is what Tiny Health uses to measure what microbes are there in your vaginal microbiome. We know what bacteria should be there or shouldn't be there. So your vaginal microbiome should have an acidic environment, which means it should be Lactobacillus dominant. So Lactobacillus is a bacteria. You may have heard of Lactobacillus through probiotics that you pick up from the shelf in the store and things like that. So Lactobacillus probiotics create an acidic environment because it creates D-lactic acid. So in the vaginal microbiome, that means an acidic environment means that it can keep pathogenic or disruptive microbes out of the vaginal canal. So you want the vaginal microbiome to be very low in diversity. So only 1 or 2 types of microbes, ideally, Lactobacillus. And it also depends on the strain. What strains of Lactobacillus really does matter. So, if you don't have Lactobacillus in your vaginal canal or have low Lactobacillus, then it could allow room for disruptive bacteria like Prevotella, Gardnerella vaginalis, Streptococcus, things that are connected to BV, bacterial vaginosis, which is a type of condition in the vagina where it causes itching and discomfort, smelly discharge and things like that. And it's unfortunately quite common in women, who have itching and things like that, which is sometimes misdiagnosed as yeast infection if you go to the doctor's office and they don't maybe use the right technology to sample your vaginal microbiome. So basically, there are different community state types, which just means it's meant to show if you have a Lactobacillus dominant vaginal microbiome and what strains, what species. So CST1, so community state types, and for short, CST. So there's 5 broad categories of vaginal types. Ideally, you are CST1 or 2. So CST1 is Lactobacillus crispatus, and crispatus, the Lactobacillus species, is specifically, they produce lactic acid at a higher rate than other Lactobacillus species, which again is the most protective species or Lactobacillus species for the vaginal canal, which means it helps fend off potential pathogenic bacteria. So that's the healthiest, in a way, the healthiest vaginal microbiome. And the second one, CST2, is L. gasseri. So still very productive, but it doesn't produce lactic acid as much as crispatus, the first one. But these 2 state types have been shown to be more conducive for fertility and IVF outcomes. Then you have CST3, which is also Lactobacillus dominant, but it has this species called inners, so Lactobacillus inners, that are basically a little bit neutral. So it really depends on what else is there in the vaginal microbiome, aside from L. inners. So it could go positive if it's surrounded by good microbes, and negative if it's surrounded by other disruptive microbes like BV type microbes. So its role is a little bit kind of variable. And it depends on lifestyle factors as well. So I would say CST3 is emerging to be, there's actually emerging science that shows that CST3 is correlated with actually fewer pregnancy rates than CST1 and 2. So it's interesting. It's very interesting. There's still a lot of research being done. CST4 is what you, in a way, where you don't want to be, which is no lactobacillus. Typically, CST4 is connected with BV or yeast infection or other kind of vaginal symptoms. And then finally, CST5 is Lactobacillus jensenii, which is also a healthy microbiome. It's just very rare and not commonly found in women. So there you have, hopefully it's not too complex, and there's 5 major types. So you want to check in to see what CST you are. Personally, I would, if I'm trying to conceive, you'd want to be ideally 1 or 2. CST3 is very common though in women. I think most women have CST3. So there, again, as I mentioned, you want to know what else is there. What is the entire breakdown of your vaginal microbiome to see if it tends to be more positive or negative, and if you need any course correction. And ideally, if you have the more BV type bacteria, the disruptive bacteria as CST3, you want to nudge it towards CST1 or 2 through supplements and diet.
Wow, I could learn about this part all day. I could listen to you talk about these community state types all day. It's interesting how you said we actually want very low diversity in the vaginal microbiome, which is different than the gut microbiome, where we're always talking about we want so much diversity. And I was just noticing how that's such a distinct difference between those locations.
Yes, 100%. And the reason for that is really because you want it to be lactobacillus dominant, right? Again, you want it to be crispatus or gasseri ideally. In CST4, which is what you don't want, again, it's linked to lower IVF success, lower pregnancy rates. And also, if you do get pregnant with CST4, you are at high risk for preterm labor. So there is some correlation there as well. And CST4, if you don't have any lactobacillus, then in a way, like any number of disruptive microbiome could inhabit your vaginal canal, so diversity increases. And therefore, you don't want that. You want as low diversity as possible in the vaginal canal. So it's opposite from the gut, because you're right, in the gut, in adults, you want as high diversity as possible. The higher diversity, meaning the types and the range and different species, will mean that you have a more robust gut. If you get ill or sick, you have a more resilient gut that can bounce back if you have higher diversity. So if you're limiting foods, which is kind of why, a lot of people do elimination diet or limited diet that could really affect your gut diversity. So you want to try to do that for short term, because ideally we are able to tolerate a wide variety of foods, and that's actually pretty beneficial for our overall health.
Let's take a quick moment for this week's Fertility Supplement Spotlight, brought to you by my most beloved perinatal nutrition powerhouse, Needed. One of the magic ingredients for optimal fertility in pregnancy is a happy and healthy microbiome. Needed's pre- and probiotic supplement is packed with clinically studied strains of probiotics, prebiotics, and polyphenols. It's really like a VIP party in your digestive tract. Thinking beyond just your gut health, Needed's pre- and probiotic supplement also supports key perinatal needs like vaginal health and iron absorption. Formulated in collaboration with leading perinatal microbiome experts, Needed's pre- and probiotic is the real deal. Take it before, during, and after pregnancy, or even beyond. If you're ready to kickstart your fertility and pregnancy journey, head over to thisisneeded.com and use code Functional Fertility for 20% off your first month of Needed products. That's thisisneeded.com and use code Functional Fertility, all one word, for 20% off your first month of Needed products. Big thank you to Needed for supporting our show with this week's Supplement Spotlight. Thinking about these community state types and the vaginal microbiome, after you and I did our Instagram live together, a listener wrote in a question, and I wanted to pose this question to you. And they said, can oral probiotics alter the composition of the vaginal microbiome? Should I be inserting probiotics vaginally? Like, what is that crosstalk? How does that work?
Yes, it is very interesting, right? I think like we used to be more exposed to oral vaginal probiotics. So sometimes when if you go to a doctor and they're recommending a women's health probiotic, it's usually usually contains Lactobacillus species for vaginal health. But the scientists at Tiny Health thinks that it's a longer route to implant or colonize from the oral. It has to survive the gut tract, the stomach acid, and make it all the way past the large intestines to the vaginal tract, right? It's possible. It's just a longer route. So we believe that actually vaginal suppository is a more direct route, a shorter route, and it helps colonize better. But we'd actually recommend doing both. If you have a CST4 or if you have a CST3 with disruptive microbes, we'd recommend doing at least 2 months of vaginal suppository, and combined with a good vaginal oral probiotic as well. And then with the right diet too, because things like medication and antibiotics can also influence the vaginal microbiome. So we think that, okay, taking antibiotics will ruin my gut microbes. It can also affect your vaginal microbes, right? The same way oral vaginal probiotics can affect the vaginal canal. It's just a longer route.
It's so interesting. And so are you typically seeing that this comes up in my practice sometimes? Is it the same capsule that you're taking one orally and inserting one vaginally, or are these different products?
There are different products, and if you do a Tiny Health test and you have those state types that require a suppository, we would recommend ones that we have seen kind of like with more clinical evidence. There's not a whole lot of companies that are producing these suppositories. It's a newer thing. Again, like I think for the vaginal microbiome and vaginal probiotics, there's a lot to catch up on from, very limited, like in a way compared to gut microbiome research. Vaginal microbiome research is in a way still catching up, right? And so the probiotic manufacturers are also still catching up. But we're seeing a lot of new innovation. I think Seed just launched a vaginal probiotic as well that's very promising, that has the right species. A lot of vaginal probiotics sort of historically has different lactobacillus species. They have L. rhamnosus, L. reuteri, L. acidophilus, a lot of different lactobacillus species that are not in the top 5 that I mentioned, right? So I mentioned Crispatus, Gasseri. You won't see inners in a probiotic, and then Jensenii. So you kind of want to look out for, if you want to nudge your microbiome to a state type 1 or 2, you kind of want to see L. crispatus or L. gasseri in your vaginal probiotics. And even that is hard to find, right? But we've managed to find some, and that's what we recommend in our test if you need it. So it's important not just to pick a random probiotic off the shelf. You want to ideally pick the right species. Now, there's a lot of science backing those other lactobacillus probiotics, as I mentioned, the reuteri, the rhamnosus, the acidophilus, because we think that taking those lactobacillus can still create an acidic environment. It's just not going to colonize your vaginal canal. We don't ever see rhamnosus, reuteri, acidophilus, and things like that colonizing the vaginal microbiome. It just doesn't. It doesn't even colonize the gut microbiome. It's really there to create an acidic environment in the gut or vaginal microbiome to fend off pathogens, right? So it plays its role. But, with science emerging, again, there are new suppositories containing Crispatus, Gasseri, and we've seen results from our customers who went from a CST4 to a 1 or 2 using those suppositories. So small sample size and more studies need to be done, but it is possible to change your state type. It just takes a lot of discipline and a much longer journey, maybe 2 to 3 months. And, again, as you can imagine, suppositories are not super easy to apply, right? You do need an applicator and you need to be consistent in doing it. I think most companies recommend once every other day. And then some companies also have a gel that you should apply before, which is equivalent to the prebiotics to the probiotics. And if you understand the science of probiotics in the gut, if you're taking a gut health probiotic, you want to make sure you have the prebiotic accompanying it too. Otherwise, it won't colonize, right? So prebiotics are like the food to the probiotics. So in nutrition, it's like dietary fiber or polyphenol-rich foods like berries and something that's very rich in color, those are really good prebiotics that will help the probiotics to colonize in the gut. So similarly, in the vaginal microbiome, there are prebiotic gels that you can find that will help these healthy, beneficial microbes colonize the vaginal canal.
It's so funny. As you were talking, I was like, gosh, I know how to do this in the gut with prebiotics. How would I do that in the vaginal microbiome? So, like I said, I'm always learning so much from you. You mentioned that the treatment timeline might be 2-3 months. If we shift our state type, do you find that those changes are enduring, or we go back to our lifestyle that we had before and then the community state just shifts back? Like, is there a maintenance of that renewed community state type?
I wish I knew the answer, but I
Yeah,
have to be frank, I don't know. If we
to be
had
determined.
long-term longitudinal studies, then I hope one day, especially with tiny house population, if people retest, then we would get that information. So I encourage anyone who's had that shift to continue testing, frankly, so that we understand better if it's temporal or long-lasting. With the little data that I have seen, where there's dysbiosis and then it kind of went to a good type, it has maintained, I think, with good dietary and lifestyle maintenance, I think you can maintain it. But we just don't know. Like, a lot of things can influence the vaginal microbiome just as it could the gut microbiome, right? Like hormone changes, right? When you do get pregnant, it may change your state type. Post-pregnancy too, this is very interesting. Your vaginal microbiome tends to get disrupted. So mine went from a CST1 to a 4, so a very unhealthy state type postpartum for 18 months because I was breastfeeding. So, and I didn't have my menstruation until at least 1 year out. So these things actually make your vaginal microbiome lactobacillus deficient. And we were wondering, oh, why are we being punished postpartum with a worse itching vaginal microbiome? But we think now it's maybe like nature's way of child spacing, because it's harder to get pregnant in a CST4. So maybe like it's again like, oh, maybe it's just your body's just preparing you to not have the next child so quickly, because again, getting pregnant on a CST4 is not great because it has a higher risk of preterm labor. And it's interesting because we do know from research that if you do get pregnant within the year after your first kid, there is a higher likelihood of preterm labor. So it matches with, other research that's being done, observational research, right? And maybe because of the vaginal microbiome is disrupted. So it's really fascinating. You want to wait till your vaginal microbiome is returned back to its hopefully ideal state in CST1 or 2 before trying to get pregnant again, which again goes to show how interesting the vaginal microbiome is as it relates to the whole fertility journey, postpartum, and all that.
Makes me want to test the vaginal microbiome before each pregnancy. Like when my couples get ready to try again, it makes me want to test again. And with that, what's the testing frequency that you're recommending right now if someone does want to retest, just to make sure that the interventions have shifted their community state type? What's the recommended cadence?
Yeah, for vaginal, about 2 to 3 months, because again, I
Okay.
mentioned it takes that much time for the vaginal microbiome to shift. It's just much harder than, I would say, even the gut changes a lot quicker with dietary changes than the vaginal microbiome, right? So you really have to be disciplined about that suppository and oral vaginal probiotics. And ideally not be exposed to antibiotics during that time frame as well, but about 3 months.
Tiny Health is doing some research right now, like I said, to understand how the microbiome can impact IVF treatment. This study is ongoing. Will you tell us a little bit about what the study looks like and what type of participant you've recruited?
Yes, for sure. So yes, we have a Tiny Health Research Edition kit where we work with research partners on different themes and kind of hypotheses of how the microbiome, vaginal or gut is related to certain conditions. So we know that 12% of women experiencing infertility turn to assisted reproductive treatments like IVF. And this results in over 400,000 cycles per year nationwide, just in the US. And it's expensive, as you know, with $15,000 to $30,000 per cycle. And what's kind of interesting is that less than half of these cycles result in live births, right? Just half, with many women experiencing repeated implantation failures and often attributed to unexplained factors, right? In the absence of embryogenetic abnormalities. So with this study, our research partner is looking to investigate how the microbiome environment of the gut and vaginal microbiome may be contributing to IVF success or failure, specifically implantation failure. So we're using this data to see if, our research partner can maybe develop future treatments and by understanding better the fertility kind of the implantation rates as it relates to microbiome. And specifically, they may be a role in the phages, which is, a new term in sort of like that your listeners may not have heard of. So phages are the viruses that attack the microbiome, the microbes in the gut or vaginal canal. So, these viruses don't attack human cells, but they attack the microbial cells, right? So our partner suspects that the phages may have a role in disrupting some of the vaginal microbes as well.
As a clinician who works with so many couples and women who are preparing for IVF, I dream of the day that we know a bit more about exactly what you're studying so that I can help with specific and targeted and precise interventions that can improve the outcomes of IVF. Because even if someone needed 1 cycle rather than 4 or 7, that would be a huge improvement in the financial investment and the investment of their time and energy and emotional and mental health. I just can't imagine how valuable that would be. So I am on the edge of my seat waiting for these results.
Exactly. And if you're already spending, again, $15,000 for a cycle, what's, to spend another $100, $200 on a vaginal or gut microbiome test to give you more information about what's in your own body, right? It's your data, it's your microbes. And it has such an outsized influence in our health and our reproductive journey as well. And so I think, and there's more to go into in terms of like your future kids' health, lifelong health, right? Including your own health. So it's a small price to pay to learn more about what's in your body.
And it just occurred to me to ask, when we're thinking about testing the vaginal microbiome, are you finding, and this is a very general question, and maybe there's not an answer for this one either, but I'm just wondering if you're sometimes surprised by the results. Like maybe someone doesn't have a lot of vaginal symptoms, but we see their testing come back as one of the community state types that's not so ideal for pregnancy. And we never would have known unless we did the testing.
Mm-hmm. Yeah, that could be it. We definitely have users who are surprised by their results.
Mm-hmm.
But most of the time, if you have a CST4, you will have some symptoms.
Mm-hmm.
I think there has been some surprises, again, based on the reproductive journey, like postpartum, where someone finds themselves in CST4 and they're surprised by that because typically before pregnancy, they don't have symptoms, right? And then all of a sudden, postpartum, you may not have symptoms, but again, your CST is not the ideal type, maybe for child spacing reasons. We don't know, but it's certainly influenced by your hormones as well.
Wow. So much to learn and to gain all these insights. So looking to the future, my final question for you, because I want to follow what you're interested in. What are you most excited to learn about in terms of microbiome science? Like what's the next thing that you want to research, or what do you feel most excited about diving into the literature on?
Oh, wow. There's too much.
I
We have a
know.
long list on our science team roadmap to investigate, especially as it relates to the more complex chronic conditions. And I think for the vaginal microbiome specifically, because we were speaking so much about it, I recently have been very interested in CST3. Again, it's kind of it's been known to be still a relatively healthy state type, but emerging research is starting to point to like maybe it's not the best vaginal microbiome, right? It's kind of L. inners is again like it can go either way, but there has been recent research that shows that there's lower pregnancy outcomes or pregnancy rates in CST3, sorry. So that's an area that I'm very excited to kind of dive into. And we actually have a lot of data on what state types and kind of like survey, like health survey on if they're able to have kids or not. So actually interested in diving into all that data. And in the coming months, our science team is actually planning to publish a lot of infographics and some of the juicy findings we've had from our own customers in a de-identified, anonymous way, of course. Everything you share with us is private and we don't review any personal information, but it's interesting to kind of derive data from that research, right? Our internal research on what certain state types are linked to.
Well, I will have my eye on all the work that you're doing because it is so fascinating and so important and so actionable and relevant. For any listeners who want to learn more about Tiny Health, where should they find you?
Yeah, that's easy. It's come to tinyhealth.com. Tiny health means like the tiny invisible microbes in your gut or vaginal microbiome. It can also mean tiny babies, and hopefully you'll have many of them in the future. Yes, and then our Instagram handle is at tiny.health. And if you DM us, we'll respond really quickly. And then you can also reach me. I read a lot of the hello@tinyhealth.com emails. So if you have a question, or yeah, just anything you like to know, just you can DM us or email us.
Amazing. And if you're one of my patients listening, I can help you order this testing and access this testing. So we're really excited to learn more. Cheryl, thank you so much for being with us. It's just always such a joy to hear you talk and to do what you love and also teaching us so much. I can't wait to see what the future holds for Tiny Health and just really appreciate you being with us today.
Thank you. It's an honor to be here.
See you next time, everyone. Did you love this episode and want to hear more? Head over to drkaleawattles.com/podcast where you can find more episodes on all things fertility.